Hey everyone, welcome back. Ready for another deep dive?
Let's do it.
All right, today we're tackling something that, well, kind of hits close to home for everyone, right? We're looking at obesity.
Oh, yeah. Big topic.
Huge. And how it all ties into healthcare. And of course, we can't talk about healthcare without those lovely health insurance premiums.
Definitely can't avoid those.
So our jumping off point today is this blog post. It's called How Obesity Affects Health Insurance Premiums. Catchy, right?
Straight to the point.
Totally. But the real gold mine is the comment section. It's like a mini policy debate exploded down there.
That's where it gets interesting because it really highlights how this goes way beyond just, should I have that extra slice of cake?
Right.
It's into economics, policy, even like philosophy almost, when you think about individual choices versus what we do as a society.
Oh, absolutely. It's a lot to unpack. But let's ground ourselves first. The blog starts with some World Health Organization stats, and they're kind of eye-opening. Back in 2016, get this, over 1 billion adults globally were considered overweight or obese.
Wow.
I know, right? And they're projecting that number to jump by like 30% by 2025.
Yeah, those numbers are definitely climbing.
It's a massive increase. So, okay, that's a lot of people. But how does that, translate to actual costs?
Well, think about it this way. When more and more people are at a higher risk for chronic diseases,
Things like what?
like type 2 diabetes, heart disease, certain types of cancer, you know the list. That all means healthcare costs are going up, up, up.
And insurance companies. Yeah. Well, they're not just going to absorb that.
Right. They got to account for it somehow. So unfortunately, that usually means higher premiums for everyone.
Okay, wait. So even if I'm the one hitting the gym, eating my salads, I'm still helping foot the bill for those who aren't.
It's a shared burden, yeah. But it's not just about the money either. Think about the strain on our whole healthcare system, the potential drop in how productive we are as a country, and obviously the toll it takes on individuals and families emotionally and physically when they're dealing with these health issues. It all adds up, It's like this ripple effect that touches everything.
It's huge, yeah. The blog also mentions something I keep seeing everywhere these days, Ozempic. They even talk about James Corden using it for weight loss.
Oh, yeah, I heard about that.
Honestly, that sparked like a week-long debate in my friend group.
Yeah.
What do you think about these new medications? Are they the answer to the obesity problem?
Well, that's what makes this whole issue so tricky. On the one hand, Ozempic, Wegovy, these drugs, they do offer some real potential, especially for folks who've been struggling. There's always a but. It's not a magic bullet. We have to look at the long term. How well do they actually work over time?
Yeah.
What about side effects?
Right. Those are important.
And then there's the ethics of it all. Is this really about health, or are we getting into cosmetic weight loss territory here? That's a whole other conversation.
Yeah, no easy answers there. Which is where that comment section gets juicy. It's full of people weighing in with all kinds of ideas.
Oh, I love that. It's like a brainstorming session on a global scale.
Some are more practical than others, that's for sure.
It's about getting all those viewpoints out there, right?
For sure. So we've got Alex, who's all about government programs to push healthy lifestyles.
Yeah.
Education campaigns, maybe subsidize healthy foods, things like that. Sounds good, right?
Yeah, those kinds of things definitely help nudge people in the right direction. But then you've got Rosalie jumping in.
Oh, yeah, Rosalie.
She's pointing out that, hold on, it's not that simple for everyone. Telling folks to eat more veggies ignores the fact that some people literally live in food deserts,
What are those again?
Places where fresh produce is hard to find and super expensive.
Oh.
And then there's the relentless marketing of processed foods, especially in low-income communities. Those systemic factors make a huge difference.
It's true. It's kind of like telling someone to pull yourself up by your bootstraps when they don't even have boots.
Exactly. It's about creating a world where healthy choices aren't just an option, they're the easier option, and often the cheaper one.
Makes you think, for sure. Oh, then there's Tanner's comment. This one blew my mind a little. He compares this whole situation to, get this, the bird flu outbreak.
Wait, the one in Vietnam?
Yeah. He was talking about how dozens of tigers in zoos ended up dying from it.
Oh, wow, that's right. I remember that.
So his point is that just like those tigers were vulnerable to disease because they were, captive, a lot of people are vulnerable to obesity because of things beyond their control. It's like their environment sets them up for it.
Powerful analogy. Makes you realize how much our surroundings shape our health. It's not always about willpower alone.
And then the comments get even more interesting. Amir suggests integrating grocery stores right into public housing, or low-income neighborhoods. How cool would that be?
Right. That is such a smart idea.
It's tackling like 5 problems at once. More access to good food, people can actually make healthier choices.
Could create jobs too, boost the local economy.
Talk about a win-win. And then we've got Holden. He's all about getting kids involved. He thinks we should have community programs where they design healthy recipes, learn to cook.
Oh, I love that. Getting them excited about healthy eating from a young age.
Right. Plant those seeds early.
Yeah.
But of course, not everyone's on board with focusing only on those external factors, you know.
Right.
We've got Molly, who's a little worried that doing that takes away personal responsibility.
Mm-hmm.
Like, we don't want people to think it's not their job to take care of themselves.
Yeah, it's about striking that balance, isn't it?
For sure.
Yeah.
How do we recognize that the system isn't always fair, but also empower people to own their health? Tricky stuff.
It is. There's no easy answer to that one.
Definitely not. But to end on a more positive note, Lila seems to think we're already seeing some progress.
Yeah.
You know, where people and policymakers are actually working together to make things better.
Yeah. Collaboration is key, right? We can't solve these big, messy problems by pointing fingers.
I like her optimism.
Mm-hmm.
We've got to believe change is possible. But before we get too warm and fuzzy, there's this one comment we have to talk about. Cash Keith drops this bomb that kind of shifts everything.
Oh, Cash Keith, he always gets people thinking.
He does. He does. So, okay, Cash Keith, he jumps into this whole discussion about obesity, healthcare costs, and basically says, what if we're all just, like, distracted?
He brings up some pretty heavy stuff, actually.
Oh, yeah. Like what?
He mentions those warnings from Sweden and Finland about, the possibility of war breaking out.
Oh, right. Things are definitely tense over there.
And then Cash Keith asks this really pointed question. He's like, is worrying about your insurance premiums really any less crippling than, the thought of a global conflict?
Whoa, okay, yeah, that puts things in perspective. It's like our anxieties about health, money, they might seem kind of small when you think about, like, the potential end of the world.
Right. It makes you question what we should be focusing on. Are we so caught up in our own individual worries that we're missing the bigger picture?
Yeah, but then again, if we're not healthy, like both physically and financially, how can we even deal with those huge global issues? It's kind of catch-22, right?
Totally. It's about finding that balance. We can't just ignore the stuff that's affecting our daily lives, but we also can't be paralyzed by fear of, the apocalypse.
Easier said than done, though.
Yeah.
So, bringing it back to our main topic, what does this all mean for someone trying to understand how obesity and health insurance are connected?
It adds a whole other layer of complexity. Like, it shows how something that seems kind of straightforward is actually tangled up with all these bigger issues.
Social stuff, economic stuff.
Even geopolitical stuff with those war warnings. It's not just about what individuals choose or even what policies our country puts in place. We're all connected on a global scale, and it's wild how that all plays in.
Cash Keith's comment almost makes you think that solving the obesity problem isn't even the right way to think about it, you know?
It might be more about understanding how everything is connected.
Yeah, and working on all those different levels.
Exactly. Personal behavior change, systemic reforms, heck, maybe even international cooperation. It all plays a part.
Man, this deep dive has taken us on quite a ride. Started with health insurance premiums. Now we're basically contemplating the fate of humanity.
That's the beauty of these conversations, right?
Yeah.
You never know where they'll lead.
So if we had to boil it all down to one key takeaway for our listeners, what would it be?
I think the biggest thing is that the impact of obesity on health insurance and just healthcare in general is really complex.
There's no easy fix, no magic solution.
No, it's about understanding how our choices, the systems we live in, and even what's happening on the world stage are all intertwined.
And then Cash Keith comes along and throws that curveball about global conflict, and it makes you think, wait, where does public health even fit in when we've got all these other huge problems to worry about?
That's the million-dollar question, isn't it? How do we prioritize health issues when there are so many other things going on? And how do we make sure everyone has access to affordable care, no matter what's happening in the world?
Heavy stuff to ponder. Might feel kind of overwhelming, honestly.
It can be, but remember, the first step is awareness. The more we talk about these things, the better chance we have of actually making a difference.
It really makes you think about the big picture, doesn't it?
It does, and that's a good thing. Thinking critically about all these connections, that's how we start finding real solutions,
Yeah. Solutions that actually work.
Exactly. And it's not just about big sweeping changes either, right?
Yeah.
Our everyday actions, they matter too.
So it's not just up to, like, the government or the healthcare system to figure this all out.
Definitely not. It's on all of us. We all got to take responsibility, make those informed choices.
Whether that's pushing for better policies, supporting those community programs we talked about, or even just like making healthier choices ourselves. Every little bit helps.
Exactly. And remember those aha moments. That's what we were hoping to spark today,
I think we had a few. I know I did. We went from health insurance premiums to
basically the fate of the world.
pretty much.
Yeah.
We talked about different ways to tackle the obesity issue, dove into those different viewpoints on policy, and then zoomed out to that global scale.
It's all connected, right? We might not have all the answers, but hopefully this deep dive gave everyone a new way of looking at these things.
A new lens, as they say.
Yeah.
So, thinking back on everything we talked about, what's your biggest takeaway? What really stuck with you?
That's a good question, I think. Well, what about you? What really resonated with you?
I think, for me, it's that there's no simple fix. This isn't a problem we can just throw money at or pass a law and it goes away. It's going to take a lot of different approaches working together.
Yeah, and a lot of open minds and a willingness to, really challenge our assumptions.
That's the key. Got to keep those conversations going.
Absolutely. So to everyone listening, keep asking those questions, keep digging deeper, keep learning.
That's what it's all about. Well, that wraps up another deep dive.
Thanks for joining us, everyone. It's been a blast, as always.
Until next time, stay curious, stay engaged, and keep exploring.